All right, so this is feminizing therapy for trans feminine patients and transgender women, part 2. I couldn't fit it all in my last video, so I'm gonna have a little bit left in this one. So I mentioned that patients will either be on spironolactone and sometimes bicalutamide as androgen blockers. Some patients choose to be on weaker anti-androgens like 5-alpha reductase inhibitors. This is more for patients who are looking for partial feminization, and it also can be used as add-on therapy for patients who are on full androgen blockade but still experience virilized features, or those patients who still have some hair loss after complete androgen blockade or even an orchiectomy. So progestogens like progesterone may have a placement in therapy for some patients. There aren't a lot of studies with them, but there are some reports that it helps with sleep, anxiety, and possibly breast development and libido in trans patients. This is a gonadotropin-releasing hormone analog or agonist. I talked about it in part 2 of trans masculine therapy. They're usually used in transgender youth for puberty blockade, or sometimes if patients can't get adequate androgen suppression on alternative therapies. It's a pretty expensive medication and insurance may choose not to cover it. And again, it has some side effects that some patients can't tolerate, like nausea, general pain, hot flashes, mood changes, and headaches. So what I forgot to touch on my last video with estrogen therapy is, again, with the blood clot risk, smoking also poses a risk. And transgender and even queer individuals do have a higher propensity to smoke. So nicotine replacement therapy may be warranted. In Indiana, pharmacists can prescribe this. So there's a gum, there's a lozenge, there's even an inhaler, Nicotrol, you can use. There's a patch. Gold standard therapy is usually an oral and a maintenance, so like a lozenge and a patch. Some patients can also use Wellbutrin. Again, I don't believe that works very well. Or Chantix and varenicline. Chantix, again, off the market, but the generic varenicline is readily available. Some patients do experience some psychiatric side effects with that, as well as nightmares. But that's all for today. Leave a comment if you have any questions, and I'll try to answer them if I can.